Nā koutou katoa, ko Lisa te moringa ahau, ko au te co-chair o Health Coalition Aotearoa. Nau mai, hara mai ki tēnei webinar. He mihi nui ki a koutou mo te pātai mai, me te whakanui I tēnei hui. Ko te kaupapa o tēnei rārangi kōrero he tino nui ki a tātou. A e tū mānako ana mātou ka whaihua koutou I ngā kōrero ka tūkuna. Kia mau ki ngā whakaaro a me te pātai I ngā wā katoa. He karakia mō te timatanga mō tēnei hui. Kia tau rā ngā manakitanga a te runga rawa ki tēnā o tātou e tau nei. Kia tūturu ōwhiti whakamaua kia tina. Hui pae ki e. We are thrilled to be hosting this webinar, Bitter Pill or Sweet Solution, to make a case for a sugar levy or tax in Aotearoa. HCA members have always been keen on advocating for a sugary drinks tax, but with the cost of living crisis over the last few years, we've focused our food policy advocacy on initiatives to improve access to healthy food, particularly for children. But a sugar levy remains on our radar as a tool that could be implemented to help nudge our food system in a healthier direction. So we felt it was high time for an update on the latest evidence around the benefits of implementing sugar taxes, thus the topic of today's webinar. I'm delighted to introduce today's facilitator, Ganesh Raj. Ganesh is a familiar face on New Zealand TV screens, having featured in numerous shows, including Eat Well for Less New Zealand. He's also a passionate advocate for better food systems, so he's the perfect facilitator for this topic. And he'll also be facilitating the question and answers Q&A session at the end of today's kōrero. So thank you, Ganesh, and over to you.
Thank you so much, Lisa, for that kind intro. Let's get straight into it. Our first speaker today, Arantxa Colchero, is a health economist and associate professor at Mexico's National Institute of Public Health. Her research focuses on using taxes and subsidies to improve diets and reduce consumption of sugary drinks, ultra-processed foods, and alcohol. Today, she'll be sharing insights from Mexico's experience with the sugary drinks levy. Welcome, Arantxa. Thank you so much for being with us.
Thank you very much, and thanks for the invitation. I will talking about the experience of the SSB tax in Mexico. So just to begin, I'm sorry. Okay, so just to begin. So the current SSB tax in Mexico, we have a volumetric tax. So it's a 1 peso per liter, and it was implemented in 2014. And it includes sodas, flavored water, juices, concentrates, powders, syrups, and energy drinks that had already a tax of 25% tax due to caffeine and other similar ingredients since 2011. And the tax excludes 100% juices. Now we know, and based on recommendation from WHO, that they should be included because they have at least the same calories as other juices. And beverages with artificial sweeteners, that there's important information, important evidence, and of course we know that it needs to be grown, but some countries have included these beverages. In Mexico, the consumption of beverages with artificial sweeteners is low. So the tax is paid by the producer. There have been adjustments to inflation, but the ideal happened in 2020 because it was adjusted annually. And so the tax now it's 1.57. So just to give you a context of the information and the evidence that was provided to inform the policy and the approval of the tax. So as you may know, Mexico still has very high prevalence of overweight, obesity, diabetes, and NCDs. We are very high consumers of SSB. Added sugars represent 12.5% of total energy intake, and 70% are SSBs. We estimate price elasticity to see the feasibility of approving an SSB tax, and the elasticity was high. 10% increase in prices associated with 11% in reduction in consumption. And in Mexico, the executive was the one who presented the proposal of 1 peso per liter to the Congress. There was an attempt, a higher of 20% by a senator, but it wasn't even discussed. And just very quickly, at the same time, to prevent the SSB industry to mention that there were foods that had added sugars, also the Congress approved a tax to non-essential energy-dense food of 8%. And I can talk about that more if you have questions. So just to mention fiscal revenues, in 2024, there were about 2,000 million US dollars that represent 40.1% of the GDP. Adding revenues from food taxes is 0.2%, and it represents 6% of a health budget. In Mexico, there's no earmarking, and it's not that it's not legal or it's not in the Constitution. It's just that the Ministry of Finance considers that the government should decide on how to and where to allocate resources. So this is something that happened here.
So first, I will show you the purchases or...
So just very quickly, I don't know why there was this voice. In terms of evaluations, in terms of how the first things you want to see is how prices change. And we saw a lot of heterogeneity, but in general, there was a higher increase in urban areas compared to rural areas, that it was less than the amount of the tax. Most of the evaluation is on changes in purchases, and there we found very robust estimations based on either purchases or sales. There were reductions of about 7.6% in the first 2 years. Recently, with information until 2018, with no changes in the tax, we have a 4% reduction in purchases, and the tax was more effective among the poor, who had higher reductions, and among those who purchase more SSBs. Unemployments, we found that there were no reductions either in the industry that produces the beverages, or in the stores, and this is mainly because the industry also produces the substitutes, and we saw that there were increases mostly in water. So we also found in oral health, based on administrative and surveillance data from 2018 and 2008 and 2018, reductions in outpatient visits related to dental caries, and that included both taxes, food, and SSBs, and a lower probability of experienced dental caries, and a lower number of teeth with caries. And there are several studies on the health impacts based on modeling real results on obesity and diabetes. We just published a paper on regressivity, because this is something that is very discussed by the industry. And what we found is that lower income households reduce more their proportion spent on SSBs and food taxes compared with higher income households. So that's proof that the taxes were not regressive. And this is mostly because price elasticities are higher for low-income families compared to high income, and this is in Mexico. And of course, also we saw that there were higher reductions of tax beverages and food associated with the implementation of the taxes. And this is despite the fact that there is a higher burden for low-income families. In Mexico, low-income families purchase lower quantities of SSBs and food taxes, but their income is lower, so there's a higher burden. But despite that, because price elasticities are higher, we didn't find, so the taxes were not regressive. Now, we've been thinking about how to redesign the tax. What would be the proposal? And that include changes in the rate and changes in the design. How can we do that? And this is something we've been working in the last 2 years. And first, well, we have a very low tax. The rate is low. You can see in this graph that tax shares in countries with volume-based specific SSB taxes. And so that's the tax as a percent of price. You want this to be very high. And as you see in the graph, we are low compared to other countries that have higher tax shares. We are about 6%, which is very low. The other way to see if it's low or high is affordability. And this is the cost to purchase 100 liters of a gross domestic product per capita. And this, you can see that SSBs are very affordable in the country. Prices are very low. And so based on this, what we set up the goal to modify the rate based on the median of countries in the region. And so that gave us this proposal. We know that it's very high, and we think that we need very high taxes to make a difference. So the proposal is to keep the current tax of 1 peso per liter as a minimum tax, partly because we want to avoid losing the tax, and because this tax, the volumetric tax, is a market signal to discourage consumption. So it is not, well, it's good if you have low sugar content. No, here is any SSB should be taxed equally. So that gives a very interesting and strong market signal. But we also want to add a tax to sugar content based on evidence from other countries, because it reduces consumption, but it could incentivize product reformulation. And we believe that the best way to go is a tax to sugar content. Here it's 0.12 pesos per gram of sugar, not using different cutoff points, because if you are too high in the range, it's very difficult to reduce, to go to the other range. So a linear pesos per gram of sugar is a proposal. This is approximately 10 pesos per liter, including both components, and that's a very high tax. It's associated with about 40% change in price. But we believe that something very high needs to be proposed, and then in the negotiation, of course, it could be lowered. So just as a conclusion, so SSB tax, we know they are effective to increase prices and reduce purchases based on meta-analysis and systematic reviews. There are so many countries that have implemented SSB tax in the world that there's a lot of evidence, very strong evidence. It's a proof of content. Now, we believe that high tax rates are more effective in reducing consumption and affordability. For us, even if there's no earmarking in the country, we believe that at least part of the resources, part of the revenues should be used to finance the health system reform that Mexico undertook since 2020. And because we have 50% of the population with no health insurance. So this is something that could be invested because the health system lacks resources. And these reforms would be stronger if it had more resources. Of course, fiscal policies have to be implemented with other measures, such as front-of-pack labeling, school and marketing regulation, and taxes to ultra-processed products. We already have one. Few countries have food taxes in the world. And of course, we are thinking on a package of taxes that includes alcohol and tobacco. Thank you very much.
Thank you so much, Arantxa. Thank you so much, Arantxa. That was really informative and super interesting. Congratulations, by the way, on getting so far in your country with all the different measures to help your citizens. I think that is to be looked up to. So thank you so much for your time.
Thank you, Ganesh.
Okay. Next up, we have Professor Pete Scarborough. Pete leads the Sustainability Healthy Food Group at the University of Oxford. His work focuses on policy solutions for healthier, more sustainable diets, and he played a key role in evaluating the UK's soft drinks industry levy. Today, he'll share insights from the UK model. Welcome, Pete. Thank you so much for joining us today.
Thank you. Absolute pleasure to be here. I'll just share my screen. Okay. Right then, just give me a second. There you go. Should all be seeing the slides now. I will assume that is the case. Right. So thanks very much to be here to talk to you about the UK soft drinks industry levy. It's a pleasure to be invited. It's a pleasure to speak after Arantxa. The work that's been done in Mexico is really seminal around sugar drinks taxes, and it's great to be to see Arantxa and see her thoughts on this area. So that was great to be included on the same schedule. I'm going to talk to you about the work that we've done in the UK about evaluating the UK soft drink industry levy, which was some work that was funded by the NIHR, which is essentially the National Health Service in the UK. And it's a collaboration of University of Oxford, London School of Hygiene and Tropical Medicine, University of Cambridge, Bath and Exeter. And a lot of the slides I'm going to be sharing today are put together by Martin White and Nina Rogers there that are highlighted on this screen. Okay, so just to briefly say, declaration of interest, all the studies that feature in this presentation were funded by that same project, grants from the NIHR. I'm funded by research grants from Wellcome Trust, UKRI and NIHR, their research councils and charities. Some of my research involves partners from the food industry, but I do not, and I have never received any funding from the food industry. Okay, so that's where I'm coming from. Okay. So the UK soft drink industry levy, just to give you an idea about how it works. So it's a tiered levy as opposed to the levy that's put in place in Mexico. It has 3 different levels, depending on the amount of sugar that's in the drink. So if you've got less than 5 grams of sugar in your drink per 100 milliliters, there's no tax applied at all. If you've got between 5 and 8 grams of sugar, you're in the lower levy tier, and that's about 18 pence per litre that you're charged. And above 8 grams of sugar per 100 mils, you're on the high levy tier of 24 pence per litre. It only applies to carbonated soft drinks, so Coca-Colas, energy drinks, those kind of drinks. It doesn't apply to milk-based drinks or plant-based milk drinks or 100% fruit juices. It was announced in March 2016, and there was 2 years for the industry to kind of potentially prepare for this tax, and then it was finally implemented in April 2018. We've just had some guidance from the UK government just very recently about proposals to change the UK soft drinks industry levy. They're out for consultation at the moment, so this is not definitely going to happen. But the proposals from the government is that they're going to, first of all, they're going to index the amounts of the levels so that they will rise with inflation. They were going to extend the levy to incorporate milk drinks and plant-based milk drinks. And finally, they're talking about moving the lower threshold from 5 grams of sugar per 100 mils down to 4 grams of sugar per 100 mils. So we'll see if that happens, but that's out for consultation at the moment. So the results I'm going to share from you today are from a systems-based evaluation of the soft drink industry levy. The kind of brain-like kind of shape over on the side was the system map that we built right at the start of the evaluation to guide what's the possible impacts in loads of different areas so that we can then measure them in our evaluations. And over on the right, there's all the different outcomes that we included and measured across the entire of our studies. Today, I'm just going to focus on a handful of those ones in bold. So we'll look at sugar levels, price, and volume of drinks and how the levy affected those. We'll look at purchases of sugar drinks, overall consumption of sugar, and finally look at prevalence of childhood BMI. All the results that I'm going to show you come from the same basic study design, which is an interrupted time series. So it's not randomized, but it's a natural experiment. Okay, so first of all, let's have a look at sugar levels in drinks. So the idea of the tiered tax was to encourage manufacturers to change the amount of sugar in their drinks. So the question is, did they do it? So first of all, I'm going to show you a graph. This graph is about the exempt soft drinks. So these are those drinks. These are the milk drinks, the milk-based, the plant-based milk drinks, and the 100% fruit juices. And this graph, what it shows you is the green area there. That's the proportion of drinks on the market in the UK that have got less than 5 grams of sugar, so they're not taxed. And then the yellow band is those that are in the lower levy tier, and the red band are those that are in the high levy tier of over 8 grams of sugar per 100 mils. And as we would expect with this is a time series here. For those drinks that weren't affected by the levy, there was no change in behaviour whatsoever. But this is what happened with those drinks that were eligible for the levy, okay? So this is including all the carbonated drinks. So we already started off with about half of the carbonated drinks that were eligible actually avoided the levy by having too little sugar in them to actually be levied at all. But you can see that after the announcement, there was a change and a slow drifting towards removing sugar from those drinks, to the point that after the implementation in April 2018, you saw this big increase in the number of drinks that are in that no levy tier. So basically, a lot of drinks avoided the levy completely by reformulating. And overall, what we found was 34% of all the eligible soft drinks that are on the market reformulated to avoid the tax. So it had a really big impact on manufacturer behavior. And what did they do with that sugar level? Well, they actually changed it to just below the threshold, just to avoid it. So on the left here, before the announcement, this is a histogram just looking at the sugar levels in drinks with a big spike at 0. So they're all your 0-calorie drinks. But then across the rest of the sugar range, broadly similar sort of levels of drinks. And after it was actually implemented, the soft drink industry levy, you see this another big spike of drinks with between 4 and 5 grams of sugar per 100 mils. What happened to the prices? Well, this is a bit of a noisy graph because it's got 4 different lines on here, okay? The yellow line and the green line and the blue line, they're for the low levy tier, and then the no levy tier and the exempt drinks. So you wouldn't expect much behavior there. And indeed, with the low levy tier, the yellow line, there's a lot of noise there because there's not many drinks that are there. So I want you just to focus on the red line. This is the high levy tier. So this is all those drinks that didn't reformulate, but just kept and just passed the price on to the consumers. And we see this big jump at the point where the tax was implemented. And then they stayed basically pretty consistently at that high level beyond there. And what we saw was actually they passed on the level of the tax by about 204%. So they actually doubled the price pass on to the consumer when it was passed through. And that was combined with what we call kind of shrinkflation. So we also saw reductions in volume size for those high levy drinks as well. So we saw a big increase in price per 100 mils, but that was disguised to the consumer to some degree by a reduction in portion size. Now, what happened then was we saw we looked at kind of how that affected purchases of drinks over time. The graph in the bottom right corner here is confectionery. This is our control, where we would expect nothing to happen, and indeed we saw nothing to happen there. The other 3 graphs are just breaking down those eligible soft drinks into the high tier, the low tier, and the no levy tier. And what we see in the top left corner there, you'll see that the red line is kind of your what would have happened if the tax wasn't brought into place. And so we saw a big drop off of the amount of purchases of high sugar drinks, of those drinks in the high tier. Again, in the low tier, you see a really big fall away, but that is, again, quite unusual because there's much less volume in that area. But what we did see was a big increase in the purchases of no levy drinks. Now, that isn't actually people deciding to swap drinks and say, well, I won't have Coca-Cola, I'll go to Diet Coke. That's actually a result of people just buying the same drink, but they've shifted and moved down into the no levy section. So you're getting drops in the high levy section with increases in purchases in the no levy section. But overall, that results in a reduction of sugar. So actually, this is using Kantar and using purchase data. And if you add all that up, it looks at about 8 grams of sugar per household per week, less consumption. So it all adds as reduction in sugar at the household level. If you look at it looking at consumption data, so this is on food diary data rather than kind of food purchases, you can also notice at the point of the announcement and then implementation of the levy, you see a reduction in amount of sugar consumption, both for adults and for children. And then this is really kind of passed on when we're looking at childhood BMI rates. So here, this is results just looking at girls in year 6, which is the end of primary school. So it's the age of about 11, where we have a monitoring program. So we have in the UK, we measure all boys and girls at year 6 to measure their BMI throughout the country. And what we've got here is we've got all girls is in the bottom right corner, and you can see there that there's this flattening off of the increase at the point where the levy is introduced in the UK. And you can also see in the other 5 squares, that's breaking it down by deprivation, essentially, so socioeconomic variables, with the biggest fall in BMI being seen in the most deprived areas, the most socially economically deprived groups. So that was a real whistle-stop tour in the results. I'm very happy to answer any questions afterwards. But just to kind of feedback in the summary, we saw that the sugar drink industry levy had a really big impact on the behavior of manufacturers, particularly in terms of the amount of sugar that they have in drinks. They really massively reduced that. It resulted in reductions of sugar consumption in both adults and children. It likely resulted in reductions in over and weight and obesity in girls. We didn't see the same effect in boys, so we only saw that in girls. And when we did modelled results looking at the potential impact of this on health inequalities in the UK, we saw that it would produce a reduction in health inequalities because the biggest health impact was happening in the less affluent groups. So as I say, very quick wade through the results, but I'm happy to take any questions.
Thank you so much, Peter. That was, I have questions.
Feel free, go ahead.
Just before I do that, I want to encourage everyone out there to remember that at the end of this, we have a Q&A session. So please hang around. You can get your questions in. I'm going to cheat and jump the queue. Here we go, Peter. A few different questions. I'll start with, what is my customer experience? How did I experience the levy when I went, be me on the street? I'm entering the Isle of Hell. The Isle of Hell, you know the one.
I know the one.
Yes. What is my experience? How did I experience the levy? Because I'm interested when you said, well, the customer, even though the price went up here, they continue to follow. So that means 200% increase I still paid. So that's addiction or some real dependency people. Or, sugar's taken over their life. So tell me more about customer experience.
The big experience that we saw, right, was that the big change was not through people kind of moving around and choosing different drinks. They were choosing the same drinks, but the sugar level had absolutely collapsed in them. So we saw really big falls from about 12 grams of sugar per 100 mils down to just under the 5 grams to avoid the tax altogether. And that's where you saw the biggest change in the amount of sugar that was being consumed. There was also some changes by the price point, so people seeing the price going up and so reacting to that and moving away from those drinks. But the bigger change was because of consuming the same drinks, but they had less sugar in them.
Are you saying that the consumer was educated enough to see that 10 grams was bad, but 5 grams was good, and when they saw it come down from 10 to 5, they switched?
No, they didn't notice anything. I mean,
so was it the manufacturers? The manufacturers.
They were buying a kind of so Fanta, for example, Fanta Orange Fanta was 12 grams before, it was down, then moved down to 4.5 grams afterwards. They replaced it with sweeteners, of course. So the customer experience was by and large not changed. The marketing wasn't changed. It was not announced to the consumers. It was all done behind the scenes.
You have answered my question about their devious maneuvering.
I'm
One more.
glad.
I have one more quick question, and before I think we need to move on to Andrea very quickly. Um, did you find that the levy had a significant impact on obesity and diabetes? Was there a connection?
Great question. We looked in childhood BMI because we've got really, really good, strong data in childhood BMI, and we saw a reduction in childhood BMI in girls, but not in boys. Now, I should say, I'm less confident of the results with BMI than I am with other results. And I could go into the reason why. It's quite a long answer, so I might wait and
Yes,
come back
we
to
have
that at the time.
Q&As. We have Q&As, but
Broadly
hold your
speaking,
thought for that.
the fact that we only saw it in girls and not in boys reduces my confidence in it.
Okay. I want to thank Ashley Wilson for that. There was a little chat and she popped it up and it was perfect timing. So thank you, Peter. I'm sure we'll talk more. I just want to get to our third speaker. We have Dr. Andrea Teng. She's a public health physician and epidemiologist. We got that wrong. Epidemiologist. How do I do, Andrea? At the University of Otago. Her research focuses on preventing non-communicable diseases and reducing inequities through evidence-informed policy. Today, she'll speak about the impact of sugar levies across the Pacific. Welcome, Andrea. Thank you for joining us.
Kia ora Ganesh.
Kia ora, Andrea.
And tēnā koutou katoa. Ko te rana te whakapaparanga mai, ko Waihopai, te whenua tupu, and ko Pona ki te kāinga, ko Andrea Teng taku ingoa. Tēnā koutou katoa. Pleasure to be here. Thank you for the introduction and thank you for the opportunity to share some of this work. I started my PhD in looking at taxes in Tonga a few years back. So some of this will draw on that work. But firstly, I want to acknowledge current funding is from the Royal Society Marsden Project Fund and the my other team members on this project, Dr. Viliami Paloka, it's a Tongan doctor based in Auckland, Dr. Alice Kim and Professor Nick Wilson, also and many collaborators in Tonga from the Ministry of Customs and Revenue and all Department of Statistics in Tonga. So firstly, I just want to set the scene a little bit. Coming to New Zealand, I am very privileged to follow Pete and Arantxa's talks, and for us to see what's happening in these countries is super useful. And it's super useful to see where New Zealand sits when we compare to the OECD countries. So where they've got the third highest rates of obesity in the OECD, that's following US and Mexico, and the UK is not too far away. We not only, this is not an old problem, this is something that's happened over several decades. Historically, rates haven't been that high, and this is a problem around the world. Our food environment has driven these changes in what we eat, and then in our weight and our risk factors for cancer, heart disease, diabetes, oral health. So what this slide is really useful is seeing that increasing trend over time, but also those vast inequities. We know our food environment looks different around the country by deprivation, and we can see that Pacific and Māori and New Zealand are particularly affected, and this is a big equity issue for us in terms of NCD prevention. Why and how much sugar are we consuming in New Zealand? Fascinating what Arantxa was saying about the amount of 70% was it or something that the sugar sweetened beverage was contributing to added sugar. This is what the figures look more like in New Zealand from nutrition surveys, which are very out of date and need redone. But the WHO recommends 3, 6 or 9 teaspoons of sugar maximum per day for a child, woman or man, and we can see that New Zealand totally outdoes this in the red. We're up more like 30 teaspoons a day, for example, in children. And the contribution of sugar sweetened beverages to that is very large, and that's 26% in children, and the largest contributor to sugar in their diet. So we know that they work. We've covered this. Arantxa's referred to this evidence as meta-analyses of over 14 different studies from around the world, and when we looked at it, there was a 10% reduction in consumption or purchasing of the taxed sugar sweetened beverages for each 10% tax size. So the more tax there was, the more reduction in consumption. This meta-analysis was updated in 2022 by Andrew Ava and colleagues, and they showed actually that the reduction with updated evidence was a 16% reduction in purchasing consumption for each 10% tax size. And we also know that there's a wide precedent, so over 100 jurisdictions across the world have introduced sugar sweetened beverage taxes. And when we look at the Pacific, actually fascinating, 3/4 of the countries and territories in our region, the Pacific region, have introduced a sugary drinks tax. And one of those countries that I want to talk a bit more about is one where we've done some work is in Tonga. So Tonga started introducing, well, first of all, I guess we all know Tonga is a small island nation of approximately 100,000 people. They have some very high rates of obesity and diabetes and NCDs. So sugary drinks taxes were first introduced in 2013, replacing a tariff, and then they were increased in size in 2016 and 2018. It was changed to a tiered type tax, which removed the tax off artificially sweetened beverages. So when we looked at what was the effect of these drinks using the interrupted time series analysis, we found that in the change to the excise made a small difference in 2013. That wasn't significant, but the increased excise tax in 2016 and 2017 had significant effect. This is on the level of imports. In the red line here, and the grey line is what we would have expected without any tax. So we can see a significant drop in imports in 2016, and 2017 is lower again. So showing that this drink was had its desired effect. And imports, of course, they make up over 95% of the market in Tonga of sugar sweetened beverages that are sold. The other thing that happened in Tonga when this sugar sweetened beverages taxes came in and were increased is this increase in bottled water manufacturing. So there's a clear move from sugary drinks towards more purchasing of bottled water was observed there. I'm not going to go into the food taxes in much detail, but I just want to highlight that we're looking to publish this year, but this is looking at the impact of some food taxes, which are actually quite moderate to high level taxes in Tonga, and the effect that they had on the import levels. And there was this definite trend towards reduced imports of those tax foods, and with the average reduction of about 41%, significant reduction when all those taxes were looked at together. So thinking back to New Zealand, what would things look like here? Well, I've got many colleagues that have worked on modelling in this area, and I want to present some of those findings just briefly now. So the first question we might ask is, how much revenue could New Zealand collect from a sugary drinks levy? This is a calculation that was done a few years back now, so would expect it to be a little bit out of date and a little bit bigger. But for example, if New Zealand did put a 50 cent per litre levy on all sugary drinks, in New Zealand with more than 5 grams of sugar, the expected revenue is there about 100 million a year. Of course, if we did include the flavoured milk drinks and the larger population we have now, that's expected to be more than $1 million in revenue. Now, this is a very useful study that took policies that have been introduced elsewhere, such as in Mexico and Bermuda, and applied, if the same results were found in New Zealand as what was found in Mexico, what would be the impact in New Zealand on health gains and also on sustainability. So, for example, Mexico on the left here, which Aranza has introduced already, we would be expecting a small average decrease over the whole population in BMI. We would expect 54 years of full health gain per 1,000 population. And so these findings are very similar. So the Mexico policy involved the junk food levy as well, whereas the Bermuda policy here is a larger tariff on sugar sweetened beverages, but doesn't include any taxes on food. But you can see the similar levels of health gains. But what's really interesting, I think, is that those health gains are particularly pro-equity. For example, in Bermuda, you can see you've got like 4 times the level of full health gain per population in Māori than in non-Māori. The health system savings are approximately $1,000 per person over the, this is a follow-up over the full lifetime of the cohort that was studied. And then the greenhouse gas emissions, there's a very small decrease in the daily greenhouse gas emissions from diet of about 1 or 2%. The other modelling that's been done has looked at a more broader sugar tax in New Zealand. So, for example, if we had a 75 cent per 100 gram of sugar tax across not just sugary drinks but food as well, we would be expecting even greater health gains. So this is a larger 3% decrease in BMI. I think about 5 times the years of full health gain, so 581 years of full health gain per 1,000 population over the lifetime of the cohort. It would also be very pro-equity, the sugar tax, have much larger health system cost savings and larger revenue, so 529 million revenue would be expected from that broader sugar tax. And this is compared here to a fruit and vegetable subsidy, which had lower health gains and much greater cost to government, and that cost that 529 million to implement. So just sort of trying to summarize a little bit of this information. So why would we want to levy sugary drinks in New Zealand? Well, I think we need to rebalance our food environment. We need to address this rising tide of NCDs, cancer, heart disease, diabetes, and health inequities, particularly dramatic, and this is one way that we can address those. Health system cost savings are dramatic, and we know the pressure on the health system, that would be a big gain. These sugary drinks have no nutritional benefit, there's limited satiety, they don't fill you up. It's a leading source of sugar in our youth, and a sugary drinks levy can support children's food choices. We know there's a very large evidence base and precedent from around the world, and this, as we've seen in the UK, can improve the availability of low sugar beverages, and we know safe drinking water is widely available in our context. If we went a step further, we can also levy foods high in fat, salt, and sugar. And what would we gain from that? Well, we get we target a much larger proportion of our unhealthy food environment in our diet. There'd be greater health gains and cost savings and more revenue. Thinking about things like free oral health care or the wider health system, super useful. Consensus will be needed on the foods to target nutrient thresholds, which can be done, and potential for greater cost to consumers. It might be a concern, but what we see is that consumers, of course, especially low income, as we've seen in Mexico, wasn't regressive. Low income consumers tend to spend much less on the tax foods than before. So beverage producers cannot argue also that they're unfairly targeted if we're targeting more widely sugar and cross foods. So just highlight the Public Health Advisory report from last year that also recommends fiscal measures, and particularly to focus on our children's healthy food consumption. And they also mention here marketing and advertising restrictions and school food and drink policies. So what would the sugar levy look like in New Zealand? We obviously excise applied to both locally and internationally sourced products. It would be a levy on sugar content or thresholds of sugar content, and applied to a vast majority of the unhealthy products we're targeting, if it's drinks. Adequate tax level, and that revenue can be invested into health and equity. So thank you very much, and I'll pass it back now to Ganesh.
Mihi, thank you so much, Andrea. Appreciate that. I was really curious to see how we were doing here in New Zealand, because we don't get to find out about this stuff a lot, even though it impacts our families so much. All right, thank you so much. We have some questions, which we have some time for. So let me, I guess we have 3 very, very smart people. First question, have you calculated the price elasticity of demand for sugar levy versus consumption levels? Arantxa, I feel like you spoke about elasticity the most. How does that play into you?
So the price elasticities were estimated before the tax was implemented, and so it used a data set with purchases and prices, and we found that the price elasticities were higher compared to the results of the impact evaluations. They were lower. In the first 2 years, the reduction in tax foods was 7.2%. So it was lower than what you would expect based on price elasticities. And well, yeah.
That's what it showed. Tell me something else. When they started to introduce artificial formulas into reformulation, did the customer or did the consumer have any perceptible difference in taste? Or
This is something that important is we have a volumetric tax, a very small 1 peso per liter tax. We are proposing a tax to sugar content, but hasn't been even discussed. So it's just a proposal. So we have always had these beverages with artificial sweeteners in Mexico, but the consumption is very low. And most of the substitutions after tax implementation was bottled water. I don't know if I'm answering your question.
No, I think you are, but I want to go to Peter as well. Peter, what was your experience as well across, it's good to get what Arantxa is saying. You have a different experience there.
Yeah. So, and it was a stated aim of oh, have you lost me? No, I'm there. It was a stated aim of the UK soft drinks tax to try and reduce sugar in drinks and replace them with artificial sweeteners. There's really, really good reason for that, which is that there's randomized control trials. We don't have very many randomized control trials in nutritional epidemiology. We do have them for soft drinks compared to artificial sweetened drinks versus sugar sweetened drinks. And we know that the artificial sweetened drinks reduce body mass index in kids. They're better for body weight in kids. So basically, it was a success to reduce the sugar levels and replace them with artificial sweeteners. There was certainly some anecdotal evidence at the time when it came out. Getting back to your question, Ganesh, around whether people noticed. There was certainly certain products, certain drinks claimed that they changed and then had to change back because their consumers really hated the new formulation and they didn't like it and everything. But they are just that anecdotal. I don't know. A lot of it was marketing, so I really don't know how accurate any of that is. I don't think anyone's kind of really looked into it in any detail.
No, I understand. And just one question for all three of you around pack labeling, putting warnings on product. I mean, once upon a time we had some success in New Zealand about putting horrible photos, and the whole planet's seen horrible photos on cigarette boxes, and that's had an impact. I'm not saying that, but has there been any research done on, no tax, maybe no levy, no tariffs, just warning people?
You mean front of pack labeling?
Front of pack labeling, absolutely.
We do have front of pack labeling that was implemented in 2020, but the tax was there since 2014. So and results are not yet ready. I know that from Chile there was a significant reduction in SSBs that had a label that was about 23%. Just very, 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 very quickly on your question on reformulation, volumetric taxes do not incentivize reformulation, but what we've seen is that more than 60%, 70% of the beverages, SSBs, now have a combination of added sugar and artificial sweeteners. And maybe it's because these sweeteners, artificial sweeteners became more cheaper over time. That's what our hypothesis, but it's not because of the tax.
Andrea, from your point of view, in terms of where we are in New Zealand, did you say we're the third largest in the OECD?
Yeah, our obesity rates are the
Yes.
third highest in the OECD, and we haven't. I don't know of any big policy measures we've taken. I think we're a little bit lagging here, aren't we?
Well, I mean, this is so informative for us. And obviously we're going to reflect on our own backyard about that, and listening to Peter and Arantxa. We're at a time where we have these statistics coming out of Andrea. And the only way I think we can get people to listen up top is to listen to what your guys said to you guys up top. How did you and your people convince government and convince the people who make decisions? What did they respond to in the research that made them change their views?
Good
Who wants to
question.
go first, Peter?
Yeah, I'm happy to talk about the UK situation. So
Please.
in the UK, for a start, the Mexico situation was really, really helpful. I think with public health, what happens is often there's a lot of talk around specific interventions taking place, but it takes one brave area and kind of place to actually say, we're going to actually do this now. And then a lot of places will then fall straight away afterwards and say, okay, well, it worked there, so maybe we'll try it. We've seen this with smoking. The classic example of this is banning of smoking in public places, where it was put in place in New York first and then in Ireland. And when the world didn't collapse, the rest of the world said, oh, maybe we can do that and kind of put it in place. And I think Mexico was the real kind of, it wasn't the first country in the world to have taxes on soft drinks, but it was the first country in the world to have decent evaluations of it, right? And kind of measurements of what's actually kind of happening in this place. So the Mexico, I think, and Arantxa's team is like really kind of a strong proponent of what's happened. It's certainly in the UK, that was really important in the policy debate about putting it forward. But before we got our sugar drinks tax in the UK, all of the political parties, all of the major ones, stood up and said, we are absolutely not having a sugar drinks tax. It was the Conservative Party's policy less than 6 months before they actually announced the sugar drinks tax. David Cameron, who was the Prime Minister at the time, completely ruled it out. And when it was actually announced in the budget, it was announced and was a big surprise to everyone. Even the public health community did not see it coming. They were surprised by it. Now, there's actually a whole piece of research that's been done around how is that and how did they get it to come along and produce that. And it's about, right, the areas that you'd imagine, which is you need this bottom-up approach of bringing a coalition along to try and say, this is what we want. And there was a large coalition of both academics, public health workers, the public as well, focusing on one particular measure. So focused around saying, we need this tax on sugar drinks because we know it can work and we know it could be successful. But the ultimate thing that really kind of helped it get across the line was that this was an austerity government, and George Osborne, the Chancellor at the time, was introducing disability benefit cuts at the same time he introduced the sugar drinks tax. And effectively, it was a rabbit out of the hat policy, which was to distract attention away from other policies that he was introducing at the same time, which he knew was going to be deeply unpopular. So you have to kind of, there has to be a bit of an opportunity, if you see what I mean, that can kind of push things through, and I think that's what happened. One thing I would say is it was announced 2016, so we've had about getting on 10 years of a sugar drinks tax in the UK since the announcement, and during that time it has remained consistently very popular among voters. There's no problem there in terms of lack of popularity. There's a lot of politicians that don't like it. Boris Johnson famously couldn't stand it, yeah, right? Liz Truss didn't like it either, but they're gone now.
And it's a bunch of people. Fantastic. Thank you so much, Peter. There's a lot of questions here about whether artificial sweetness, having replaced, sugar, and even in my little Dr. Google brain, I have found, question marks around artificial sweeteners replacing sugar. Have we just replaced one with something else that we've kicked the can down that we're going to have to deal with in 10 years' time?
Yeah, and as I mentioned, it's more complicated. It's very complex when it's a mix of added sugar and artificial sweeteners, because it's very difficult to put a tax on that. And because also the artificial sweeteners, you don't know the quantity, you only can put a volumetric tax. But the problem with reformulation is that the reformulation is with artificial sweeteners. And we've seen that with the front of pack labeling for food. A lot of cereals now have these artificial sweeteners, and we are concerned. I know that there's not enough evidence yet, but there's some evidence, and that's a concern related to reformulation.
Just to bring that back to me, you're saying yes, there are health risks of using artificial sweeteners. We have to look into that deeper because there's no free ride. Is that correct?
Yeah. I know it's not conclusive, and we need to have more studies because there's always the potential bias associated with observational studies, but there's a lot of evidence, and do we have to wait? It's complicated. France has a tax to an SSB tax to artificial sweeteners, beverages with sweeteners.
I apologize.
France.
Sorry, I thought you were finished. I apologize. Peter, you had a couple of randomized trials, is that right, to show weight loss?
Yeah. Yeah, I just put a couple of links. I know
Please
it's
tell
not
us
gone
more.
around the whole chat. They can be circulated afterwards, maybe. But I just think there's a real danger that you throw the baby out with the bathwater here, because we've got really good, strong evidence that the artificially sweetened soft drinks are good for weight control in children and in adults. Actually, there's randomized control trials there as well. And yet we've got limited evidence of potential negative side effects of artificial sweeteners, and I just think that we really want to be careful about this narrative around artificial sweeteners, because I'm not sure how productive and helpful it is.
I get you. I completely get you. Like I do with the cold face with families, and if you try to get someone to move from Coca-Cola to water, good luck. And artificial sweetener has become the lifeline of so many people I know who are trying to move away from processed sugars and full-on sugars. And yeah, I hear you, Peter. There's no, you can't do that to people. So maybe artificial sweetener is an evil that we have to live with. Andrea, any thoughts on that in the New Zealand context or in a global context?
Yeah, so I think, yeah, we do have to be careful. I agree. And not get distracted. I guess the point is we need to reduce sugar in our diets in New Zealand, and we need to put a tax on that. I'm interested if we had to decide between a sort of nutrient specific tax the sugar on grams per liter, or tax it with a tiered tax policy.
The grams per
in a
liter
ratio.
is
Which would
how
you do? Which would you still get reformulation, I guess, if you taxed on grams per liter of sugar?
I mean, as the dumbest one here, I'll tell you that 5 grams, that line is a simple line. We talk to humans all the time. 0 to 5 grams, relax. 5 to 8, ask yourself if you need it. And 8 and above, it's like, yo, calm down. So, simplistically speaking, I love that system from a regular person point of view. You can sell it, you can educate, you can talk about it simply. That's just my view on that. I mean, any type of way to reduce people. Now, what do we get here? How do we answer the challenge that the proposed taxes are inequitable in that their impact is greater on the poor? Anyone?
Can you explain the question? I don't understand.
The question
because
is,
this is what you want.
they're saying that the taxes are worse, the poor are worse off because they may continue to pay for that product, but pay higher prices, and therefore they are worse off. That's something I've heard too, and it's true, in terms of anecdotal, of course. What are your views, Aransha, on that?
Well, we as I mentioned in the presentation, we just published a paper where we found that we know that the poor reduced more their purchases of SSBs, and also the changes in expenditures were higher. They reduced more their expenditures as a percentage of income, expenditures on SSBs compared to higher income households. So that makes taxes in Mexico no regressive. And in Mexico in particular is because the poor consumes lower amounts of SSBs, although there's a higher burden because they have a lower income. But despite that, what happened is that their disposable income was less affected compared to the rich.
Of course.
Yeah. And can I
Please
echo that? I think it was fascinating in Tonga too. We compared low income and high income households to what happened to the expenditure on sugary drinks after the tax. And low income households, they spent much less on, they decreased their consumption, their spending on sugary drinks more than high-income households. So yeah, as a result of the tax, they spent less on these drinks that we don't need. I mean, yes, that they may cost a little bit more, and yeah, but yeah, the evidence from Mexico, I think, is really strong that they're not regressive. So I think it's the benefits are so large in terms of health for our our highest consumers and our most deprived communities. So I think it's a really pro-equity. I think we get a bit scared of sugar drinks taxes being not pro-equity, but they're really strongly pro-health equity. Yeah.
Amazing. Thank you so much, Andrea. I want to thank Peter, Andrea, Aransha, and Health Coalition Aotearoa for organizing this. I guess we'll have a little bit of a wrap up, but you guys have opened our eyes, hopefully energized us a little bit to start thinking of ways where we can implement something in our own backyards. Because that's what I'm learning from you guys. It has to work in your own backyard, and the circumstances have to be right for it to happen. But thank you for all your advice and all your study. I appreciate it.
Great.
Thank you very much.
Thanks for the input.
Thank you, Raj, for doing such a great job facilitating. And thank you to our speakers for sharing your great wisdom. Thank you to our audience. Also, we've had a huge amount of engagement, and I think that we could keep answering questions for another hour. We can't, unfortunately, but the presentations, for those of you who have missed it or want to revisit it or look at the slides, will be up on our website, Health Coalition Aotearoa, later today. So you'll be able to find that there, and we may be able to post some of the links to some of the papers and readings that Pete has given links to, and anything else that people want there. So thank you again. Running a bit over time, so I'm going to quickly close us with a karakia since we opened with one. So, unu hea ki te uru tapu nui, kia wātia, kia mama, te nākau, te tinana, te wairua i te ara tangata. Koiara e rongo whakairia ake ki runga, kia tina, hui e tae ki e. Kia ora and thank you.
Thank you.